Hi everyone, today we're talking with Cherie Frame, our Infection Prevention Director, about our recently implemented visitor restrictions and how those pertain to you guys. These restrictions were not only put into place for the safety of our patients, but also our caregivers and our community, and they were put into place with the guidance of the CDC in regards to social distancing and how we can help. Do you want to tell us a little bit about what those restrictions are and why they were implemented?
You bet. Thanks, Amanda. We implemented these restrictions due to recommendations from the CDC, as you said. And what we have done is we've created guidance to help keep everyone in our facility safe, whether it be our caregiver or our visitors. So the very first thing is we're limiting the number of visitors that can actually come in. You can have 2 visitors in just rare instances. Those are if you're having a delivery of a baby, and those 2 visitors are a certified doula that you are contracted with, and then another person who is there for your delivery. We ask that it remain the same person through your whole stay. Then the other times that you can have an additional visitor is if you have a healthy baby that's born, we will allow both parents to go in and visit that healthy baby. So we are able to make sure both visitors, both parents, guardians are able to go see them. And then the next one that we have a lesser restriction is the end of life, and we allow 2 visitors to go in and visit at the end of life. Other than that, we only allow 1 visitor. And those visitors are only in special circumstances as well. So we only have 1 visitor for a disruptive patient who needs someone to help calm them down and be able to meet the cares that that patient needs. An infant or child that is under 18 that needs the help of a parent. And we ask that that parent remain with them through their stay. And we do let me see here. I just want to make sure I say it the right way. It says 1 guardian per day. So we allow 1 visitor per day on someone less than 18. And then the other are people who had surgery, as you will need someone to be able to get the instructions for you after your surgery and get you home safely. So those are the exceptions to our visitor rule.
Mm-hmm. And why are these so important? How does this concept help us with social distancing and making sure that we're not overwhelming the healthcare system right now?
So as we know, we've been asked by many people to flatten the curve and to do social distancing. I know that there have been other Facebook Lives that have given excellent information about flattening the curve. Mm-hmm. And to flatten the curve, we actually have to make sure people don't come in contact with others. So we're doing this because our caregivers don't have the choice to stay home. They have to come into work. So we're doing what we can to ensure our caregivers aren't exposed to people who are sick or at risk of getting sick because someone came in to visit them. We're also trying to ensure that our visitors who need to come in and be seen, say you have someone who currently needs chemotherapy or radiation, they're a really vulnerable population. And in order to be safe, we need to make sure we create social distancing so that when they come in for their treatments, they're provided the safety. So we are really trying to encourage that social distancing and creating a safe place when people come to our hospitals.
Yeah, the last thing you'd want to do is come to the hospital and potentially get sick or create that sickness to go around to other people. So what are some ways that people can still visit in the hospital without actually physically going to the hospital? Do you have any recommendations on how they can feel supported, a patient can feel supported and a visitor can help support when they're not actually there?
You know, we live in a lucky time, right? We have such great technology out there. A lot of people will immediately think of FaceTime. FaceTime's a great option, but sometimes people don't think about, oh, I don't have an Apple product, I can't do it. Android has Google Hangout and Google Duo. Both of those work the exact same way as FaceTime. So even if you don't have an Apple product, you can still communicate with someone by using the Google options. We recommend text messages, telephone calls. You can send cards. You can call the patient in the room, which I already said, but there are options beyond just being there present, but we really do recommend thinking of those options of using the technology that we currently have out there to connect with your loved one while they're in the hospital and you're not able to come visit.
Yeah, and I feel like creating a routine of that too, whether it's every morning you check in on someone in the hospital or at noon during lunchtime you send them a video of you eating or something, just so you can create that really great connection with someone. So if we didn't have these visitor restrictions in place, what could happen? Can you talk about the circumstances that could happen to the community and the community spread if we didn't actually do these?
Yeah. So there's a lot of information out there on the internet about what it means to flatten the curve. And the difference one day of changing who comes into your facility or who implements visitor restrictions or who implements home isolation for people. So when communities say we're going to not allow other people to be around each other and we're going to close our schools, we're going to shut down the restaurants, we're actually working to decrease the risk to everyone around us. And there's these great graphs that show when you do that, you actually still have a lot of people who get sick, but you don't overwhelm the system. But when you don't, then lots of people get sick at the exact same time. And as that happens, then the system becomes overwhelmed, and then we're not able to give the care that your loved one will actually need, right? So we may not decrease the number of cases overall that come into our community, but what we do is we decrease the number of people at the same time with high severity of cases, allowing us to be able to actually care for our patients in a way that we can give them the care to succeed and get better. But when the system's overwhelmed, those really sick ones, we may not be able to give them the care they need to actually get better in the end.
Yeah, there's been a saying that's been going around of we stay here while you stay home. And I think that's really important for everyone to understand that our healthcare workers are working really hard to make and keep everyone safe. We just got a question that is, are these restrictions in line with other hospitals in the community or nation?
So we led forward initially. We leaned forward looking at our community to see what we can do. But I have been on a couple of groups that are with people across the nation who do my job, who are doing these exact same restrictions. We're all in different areas of how far along we are on these restrictions. Some are actually all the way done. They've been doing these restrictions for a couple of days, and some are just implementing them now. But this is becoming what is the norm in communities all across the nation.
Yeah, and I think that's really important for people to understand that this isn't something unique to Utah and to Intermountain Healthcare, but it's something that has to happen. So
It is.
if you guys have any more questions about visitor restrictions or policies, you can always shoot them below in the Facebook Live. And if you have any questions about COVID-19, you can contact the COVID-19 hotline at 844-442-5224. They're always there to help answer your questions, and we do encourage everyone to practice great social distancing. Thanks, everyone.
Thank you.